Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about preventive resin restoration. Let's start. Preventive resin restoration is basically a minimally invasive way of filling teeth that are decayed, but not decayed to a huge extent. That means the cavities are shallow, they're small, they're probably in the enamel or slightly penetrating into the dentin. And on top of that, it is very good because it is cost effective, and it is because of the fact that the preparation time is less and the instruments used in this are so small, because of which the pain aspect of the dental treatment goes down, and that's why it can give you a better dental experience, especially in children who have a fear of dentistry. So basically, this was initially in the dental community, the whole the chain of thought or the school of thought was extension for preservation. That means wherever you find cavities in a tooth, in the pit and fissures, you completely extend those pit and fissures with the drilling of the of the cavity and make the cavity huge and bulky, and then that's why you can restore them with amalgam or resin restorations. But nowadays the concept has changed. It has gone into more minimally invasive dentistry, that is conservation for preservation. Basically, wherever you find the cavitary lesions, wherever you find that the catchment areas that are there, with the help of a sharp explorer, and you find that this is the extent of the cavity which is present, which is exclusively very small in size, we will make sure that we exclusively just drill that part out and fill it. Now there are three types of PRRs, that is preventive resin restorations: type A, type B, type C. Basically it depends upon the depth, and basically in such cases you don't extend the cavity into the pit and fissures, and you just excavate the tooth that the tooth area that has the decay. You take out the active decay, fill it up with, if it's not too deep, you fill it up with a pit and fissure sealant, and then you continue the pit and fissure sealant in the normal pit and fissures. If it is slightly more into the dentin, you fill it up with the resin restoration after excavation of the cavity, and the rest of the pit and fissures you can add pit and fissure sealants. And the third one is also same, which is slightly more. Now you have to understand, because of the fact that the pain or the preparation of the tooth is less, that is why the pain experienced is less. That's why it is preferred for children. And on top of that, it has been shown in longitudinal studies of about 15 years that the life of the tooth has increased because of minimally preparing the tooth with the help of a burr. So you need to really understand that it is a much feasible form for the longevity of the tooth, because of the fact that you will seal off the pit and fissures with the help of a pit and fissure sealant, and the restoration in the cavity from the oral environment till the time these things last, because of the wear and tear, and they seal off the contact of the oral fluids and the oral environment with the tooth, thereby sealing off completely any sort of bacterial collection in that area and action leading to further cavity or decay like lesions. So that is why it is much better and cost effective, and it increases the life of the teeth. However, let me tell you, the diagnosis is only made by the dentist, and there are some specific criteria that we as dentists know that this would be suitable for a preventive resin restoration. If the cavity lesions are so big that they are very extensive, you will have to go for conventional methods of filling only, and you have to make sure that you are practicing good oral hygiene, and whatever instructions we have given you, you need to follow them. Also, till the time the pit and fissure can seal off the bacteria from interacting with the tooth, it is fine. The moment the pit and fissure wears out, or there is a chip or anything, you are most likely susceptible to get caries. Not definitely, but most likely, and that is when you need to go again to the dentist to get your tooth filled. So that's it for today. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a hi with your name, your location, and the common oral health problem that's causing you discomfort in WhatsApp. And if you have any queries, doubts, apprehensions, insights, or suggestions, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.